Another beautiful Saturday. Woohoo! Evidence-based practice. We are going to go over evidence-based practice, and this is part of a duo lecture. Sometimes Miss Candler may lecture, and sometimes I will. So I'm going to turn off the video annotation, and we are going to go right into evidence-based practice. I'm sure most of you have heard of evidence-based practice. If you haven't, you should have. My computer is being very slow to respond this morning. Why, I don't know. Okay, evidence-based nursing practice. There is a difference between evidence-based practice, evidence-based nursing, evidence-based, just evidence-based. So we say EBN a lot, and this is really what we want to talk about, is evidence-based nursing. So evidence-based nursing really asks the question, how do you give the best care possible? So how do we give the best care possible? Well, first we have to understand what evidence-based practice really is. It's an integration of best current evidence that we have along with our clinical expertise, taking into account family and patient preferences and their values and our values to make the possible best care for that particular patient. And as we go along and do our nursing, we gather information. We are actually doing research, whether we're aware of it or not, and we are taking all this information that we're noticing and we're compiling it, and we're thinking, well, there's a better way to do this. I've done this a different way, and that way was much better, and all this, so we've got to keep that in mind. Nursing is an ever-changing, living, breathing entity. It's affected by outcomes. It's affected by adverse input. It's just a living, breathing entity that we have that operates our hospital. It's the hospital's heartbeat. So it's imperative that we develop those clinical inquiry skills. We've got to inquire, is this the way I should be doing it? I thought I read something, I've kept up to date, and there's something new in evidence-based practice. So always question if the care that you're given is the best possible way to give it based on your research evidence. Then evidence-based nursing, our nursing care that we give, has the inherent power to transform nursing from a job to a scientifically based profession. This has been something that's been ongoing for years, as whether nursing is considered a profession or not. And just in the last few years, we've started becoming professionals. Before it was like only doctors could be professionals because they had doctorate after their name. They'd gone to school for so long. But nursing has evolved over the last few years that we are now a nursing profession. We have organizations, we have magazines, we have research we can do, we have research we can look up. So we've actually become a profession. Our evidence-based nursing is where it's a systematic process that we use current evidence that we to make our decisions about the care of our clients, and that also includes evaluation of the quality and the applicability of existing research, our clients' preferences, and of course our available health resources. So we take all this into consideration to turn it into evidence-based nursing. Presently we have its opinion or its experts based. Changes in nursing usually comes from the opinion of nursing experts. So we may see this in our textbook, which is what we use. Our Iggy is our expert in Med-Surg, so she is our expert-based person. And we may have a lecture from an expert nurse, such as you get OB lectures from me, because I'm considered an expert nurse after having 25 years in that field, as well as teaching that field for 15 years, I have become an expert in that particular area. So this is where we presently get our nursing from. Or it may just be someone's opinion of another nursing expert. So we always get it. Nursing is just basically formed that way. There's not really something that's used to, it was never scientifically researched, and we didn't have scientific figures to support it. But it's now going into research-based, scientifically proven, evidence-based practice. So, as nurses, especially us new nurses that are going out there who have so much to learn, not only are we learning how to be a nurse, we need to learn how to be a great nurse. And in order for us to be a great nurse, we should be evidence driven. Everything we do, all of our practice that we do should be based on research. If we're going to say we need to start IVs using lidocaine, we need to have research that backs that up. That out of there have been many studies done that prove that lidocaine given before starting an IV, you have greater patient satisfaction because they only have the little sting instead of the big stick. It takes between 10 and 17 years for the research affecting nurses to be put into practice. Now, with the lidocaine, when I first started nursing, it was something that some of the nurses did, but most of the nurses didn't want to do it because we don't like change, and we don't want to have to learn that new thing. That's been 20 some odd years ago. Probably came into being when I was in nursing about 10 years. So it is just now being a part of the policy and procedures at a lot of hospitals that say all IVs will be started with buffered lidocaine or with lidocaine or buffered lidocaine unless the patient refuses it, but it must be offered because it's been proven that it is effective in preventing discomfort with IV starts, and it improves patient satisfaction. It takes a while to learn how to do that with those, but it can be done. So let's look at some of the examples of how evidence directs nursing care. And I just gave you one of those examples. So let's look at some of these questions. All right, here's your first question. Which of the following is the correct distance to insert a catheter into the male urethra when performing catheterization? Now don't peek. Okay, I think you had time. Evidence-based nursing directs. This is research that's been done. Insert to the Y bifurcation. Proceed for urinary catheterization. Textbooks directs insert 6 to 8 inches. However, evidence-based research study shows that patients undergoing urological procedures demonstrated that the catheter should be inserted to the Y to ensure that the tube is in the bladder. The myth that's involved that is that return of urine equals in bladder. You may have an empty bladder and you don't get any return, or you may have inserted that and caused a spasm and you don't get any urine release. Or you may get urine back and it may be in the ureter and not in the bladder. So they did a study and this is what they determined. So, sorry about that. So they determined that you should, especially in a male patient, because the ureter and the is a lot further to the bladder than what it is in a female. Or the urethra. Okay. Evidence-based question. How long does it take to feed a patient who wants to eat? And I can just hear those little cogs turning in your head saying however long it takes to feed them. And I can hear some of you thinking the 10 minutes that I have to feed them. So basically, how long does it take to feed a patient who wants to eat? Rather than just saying, you know, patient down and so takes forever to eat, you may want to, you know, spend a little extra time with them. You don't know how long you should spend with them. So what does research say? Evidence-based research says that it takes 35 or more minutes to feed a patient. So here's their control study they did that gives you all of the research that they did. And with doing this scientific research, we now have an actual study group that's valid that says, yes, this is so. We did a study. And this proves that we need to spend an average of at least 35 minutes of a one-to-one assistance with the patient that wants to eat. What about the patient that doesn't want to eat? We really haven't done any studies on that, but we know it takes a long time from experience. Here's another one. What is or are the best agents to use to clean the insertion site of a central line? You all should know this because you've you've already studied about central lines. You may not have gotten to practice yet, but you will because you'll be coming to see us and practice. So which of these would be the best agent? Alcohol, betadine, alcohol, then betadine, or chlorhexidine? Well, this is why we use chlorhexidine. There were studies done that proved that the use of chlorhexidine for the vascular catheter site care was statistically significant in reduction in catheterization, colonization, and bloodstream infections. And then, of course, there was another one done. So there were two studies done by two different people that came to the same conclusion, that because of their evidence-based practice, because of their valid research, with everything set the way it should be set. They had control groups. They had the group that they were doing the study for, and they actually have a scientific research that proves that chlorhexidine is better than the others as far as preventing central venous line infection. One last one, I think. Which of the following is the preferable way to wash the perineum of an incontinent patient? Soap and water, then apply zinc oxide using disposable wipes, pH cleanser, then moisturizer and protectant, or just a pH cleanser. And many of you who've worked in long-term care probably know the answer to that. But why is that the answer? Cleanse with the pH balance cleanser. That's going to prevent you having yeast infections and possible UTIs. Moisturizer to keep the skin from drying out, and then protectant to protect it from the urine. So they did 3 different studies here. Evidence-based practice. This was controlled research with a controlled experimental group that actually did improvement. And it showed that all these things together would maintain the integrity of the perineum. So if we're cleansing with a pH balance cleanser, moisturizer, then protectant, we're doing it because it's research based, not because someone said it's better to do it that way. We know it's better. So how do we get to steps of evidence-based practice? Because we are part of that evidence-based practice. We as the nurses are the ones that help design the evidence-based practice. We come up with the questions. So these are the questions you really, or steps. You want to ask your question, you want to search, you want to think about it, you want to measure, and you want to evaluate. All those things are going to help us get to scientific research that provides us with evidence-based practice or evidence-based nursing. So an acronym that you need to remember in these steps is ASK Me. A-S-K, K for the think, and then me. Measure and evaluate. So let's go look at these individually. Step 1, ask that burning question. Why are we doing it this way? Why? Who thought of that? Why are we having to do 4 steps when we can do it in 2 steps? So it always begins, that evidence-based nursing always begins with why. Why are we doing this? Or how can we do it better? Or why is it taking so long? This is so uncomfortable. Why does it have to be? Could it be better? So these are things you'll find yourself asking. These are things you'll find yourself asking. So be sure that you are doing that. You know, you'll actually start the asking when you are after you get your practicing as an RN more comfortable in that. But also as you're a new nurse and you're putting what you've learned to practice and you find they're doing things the old way, you may start questioning. So, you know, just because you're a new nurse doesn't mean that you don't know enough to ask the burning question, okay? Ask that burning question. PICO is what we need to use in order to refine that question so that we can answer it specifically. We need to know the patient population of interest or disease, which means basically what group of patients are we going to be studying? Are we wanting to look at something that would be better for a neonatal population, or are we looking for something that would be better that we're looking at for the elderly? So what group of patients do we want? You know, intervention of interest or exposure. What change do you want to make in practice? Do you want to make a change to exclude a step, or do you think a step needs to be included? And then, of course, comparison of the interest. This is the status quo in the situation. You have to have a control group. And then determine what change you need in the patient's present reality you want. What outcome do you want to have? So make sure that that outcome is measurable. You should always have a measurable outcome. Then step 2, search. Search and collect the most relevant and best evidence available. So you really need to know how to do a literature search. Literature search, with the big World Wide Web, we have so many things available to us. Web co-host, there's just so many places that we can get reliable research and reliable literature. So you want to be sure that if once you've picked out the group, you've picked out what you want to look at, that you go and you search the literature about this. Then step 3, you gather this information. You've got to think critically, determine the level of the evidence. Determine the level of the evidence to ensure you have the best information available. So be sure that you have determined that you have validity, that your research article has good references and has reliable references, and you may have to research the research to make sure that you have validity. It's got to be relevant to what's your situation. You can't go out there and do something. If you're doing something about wanting to determine how to lower the bilirubin better in a neonate, you can't go out there and do something about breastfeeding off to the side. That's not, unless it's relevant to your situation. Now, you know, it may or may not be, but you got to make sure that it's relevant to what you really want it to be. And of course, evaluate it as it applies to the individual patient or patient population, the expertise of the nurses, the values in the situation, the policies in your facility, and make a decision on a change in the practice. Sometimes the cost of making this change is prohibitive, and it doesn't affect but just a very small population. Even though it's a wonderful change, it's probably not going to become evidence-based practice because of the better for the whole than the better good for the whole than for the one. So you see that in all nursing decisions. Step 4, be sure you measure the outcomes before you do your study and then after you do your study. You should have a pilot study on a small population before doing any institutional-wide change. So you might determine you want to do something about IV starts in your, you want to do it hospital-wide, but first you need to do it in your unit. So you're working in the patient care unit. You would do a small study in that population, and then you would, if you have good results, then you would want to continue on for an institution-wide change if that change in the smaller population was feasible. And then step 5, be sure that you evaluate the process to determine if change made a significant difference. If it doesn't make a significant difference and the cost, and it's going to cost quite a bit to make this difference, if it's not significant, it's not worth doing. It doesn't make enough difference to be out the money to make it happen. So, what were your results? Did your results come out the way you wanted them to be? Did it improve patient outcomes? Did it make any difference? Just because you made the patient happier, did you increase or decrease the cost or time? So these are questions that you have to, the evaluation process, much like the nursing process, you have to evaluate your intervention. So be sure that you remember the Ask Me. This is something you will need to know for your test. Know the acronym and know these steps, know what it means. So why do you do it? Talking about giving nursing care. Why do you do nursing care the way you do it? And, that's how I was taught in school. That's what it says in the book. And most of your nurses at the hospital will say, we've always done it that way. Why do you empty a Foley catheter the way you do? Why do you do perineal care the way you do? Well, that's because that's how I was taught in health skills. I do Foley catheter care that way because it says so in the textbook. Or, well, I've always emptied the Foley this way because we've always done it that way. We've never cared about germs going up in there, so we've never cleaned it with alcohol, even though evidence-based practice shows that it needs to be done that way. So that's the end of evidence-based practice. Be sure you ask me for your little test that you're going to have. Okay? Our correct answer, of course, should be why we do it that way. It's because evidence-based nursing shows that. We should be able to answer any question of why are you doing nursing care that way is because evidence-based practice shows that. And that is the correct answer.